Okay, we're here today to talk to you about lived experience as system intelligence. So, what do we mean by that? Lived and living experience is not just a story to be heard, it's knowledge that can help systems to learn, adapt, and improve. It's not optional, it's essential. So, my name is Ainya Taylor. I'm the Community Justice Coordinator in Moray, and I'm here with my colleague Justin, who I'll let introduce himself.
Hi everyone, I'm Justin Jansen and I'm the Alcohol and Drug Partnership Coordinator in Moray.
Thank you. And we're both based within the Protecting People team in Moray. So the Moray Community Justice Partnership, a big part of my role is to coordinate the coming together of that multi-agency partnership. There's one in every local authority area, and in Moray we have 19 organisations signed up and part of our local partnership. So we work together with those partners and with communities to improve outcomes for people involved in the justice system and support safer communities.
And the Moray Alcohol and Drug Partnership brings together local organizations and partners to prevent and reduce alcohol and drug related harm and improve the health and well-being of individuals, families, and the communities that we support.
And all of the kind of information about both the Community Justice Partnership and the Alcohol and Drugs Partnership is all on the Moray Protects website, along with another sort of number of strategic partnerships in Moray. So if you just want to take a look, if you want to get any more information, you can find that there. Okay, so people have the right to participate in decisions that affect their lives, and they shouldn't simply be the recipients of services. And all of us, have opportunities and should have opportunities to influence the decisions, the policies, and the systems that are affecting us. Participation is not just good practice, it's rooted in rights. But just creating those opportunities for people to participate is not enough on its own. And services, strategic partnerships like the Community Justice Partnership and the Alcohol and Drug Partnership, policymakers, decision makers, we must all ask ourselves, what do we actually do with the things that people tell us? What do we do with that information? Because the value is not just in listening and hearing those experiences, it's in actually learning from them and taking information from that. So we can use what people are telling us to give us insight, which can help us to understand how systems are actually experienced by people and where improvements are then needed. Data then can help us identify patterns and priorities. So bringing those experiences together and looking for the themes and the patterns within that becomes intelligence that can help inform the planning, commissioning, service improvement, and partnership working. So kind of turning that experience into evidence, what do we actually mean? So lived experience, that might tell us what happened, what it felt like for people and why it matters. We hear that through their stories, through their experiences of services, or perhaps where those services have not gone so well. Data then can kind of help us to understand how often those things might be happening, who is affected, what groups of people, whether things are actually changing over time, over a number of years, we might be able to track whether there has been a change or not. So stories on their own, without data to back that up, are often dismissed as isolated experiences. Data without that lived experience doesn't really capture the full picture. It can miss things. But together, they create system intelligence, which is the topic of the presentation today. So it's that combination of data and people's lived experience and using all of that together as intelligence. So I'll talk a little bit about how we use lived and living experience within the Moray Community Justice Partnership, and then Justin is going to do the same for the Alcohol and Drug Partnership. So this is by no means to say that we're getting all of this right. We have a long way to go, I think, like every area, and we'll continually be learning, I guess, as people's needs change and services change. So in terms of sort of formal engagement, we use things like strength and needs assessments, self-evaluation frameworks. This kind of tends to sit alongside strategic planning when we've got a big improvement plan to write. Perhaps every 5 years we might do a bulkier piece of formal engagement to do with that. But throughout that whole sort of time in between, we're doing a lot of engagement, not just for that plan. So that's through things like community engagement and co-design, development sessions. We do things within the prison. We also co-design projects with people with lived experience. We do a lot of partner engagement. So that could look like working with our kind of individual partners of those 19 partner organisations. We've worked with a number to understand and look at how they gather feedback within their own services and how that can then be used within our partnership. We've also done significant work within justice social work to look at their feedback mechanisms. We really recognise that it's hard for people to feel like they can be honest with justice social work, and with a number of our justice partners, we know it's not an easy conversation. So we're trying our best to find different ways to capture that so that we can make those improvements. And that can be really challenging to, when we don't know what people actually think of the programs and the things that they've sort of had to be part of within the service. We want to make those changes where we get that feedback. And we also, as a partnership, we agreed a partnership-wide statement on lived experience, which we review annually. And this really outlines our approach and the standards that we will hold ourselves to as a partnership. So that means that we have to consider when we're doing work with people and we're asking for them to share their experiences, there needs to be a purpose. It needs to be clear. We need to be clear what support, we're able to offer around that if it brings things up for people, talks about kind of where there's payment, what that would look like, expenses, things like that. And we ask all of our 19 partners to recommit to that every year, and that we won't take forward any work as a partnership that doesn't kind of meet those standards. We're currently working on strengthening lived experience leadership, particularly with an exciting development of a justice lived experience role within the third sector. So this role's purpose will really be to help not just the Community Justice Partnership, but lots of organisations to kind of gain better kind of relationship with people with lived experience of, the justice system, and kind of act a bit of a, be able to be that middleman between the two. Because again, as I said, it's really hard for people to come and have those conversations with services that they've potentially not had the best experience with, or it's been during a really difficult time in their life. So we're hoping that will kind of bridge that gap a little bit. And that's really exciting and new. So that I think that role will look potentially quite different in a year's time when we kind of have seen what that's like in reality. So we're also increasing opportunities for people with lived experience to kind of influence the way that group programs and things work within justice social work. Our goal is for people to kind of take on leadership of the development of those programs, and for all of that to be kind of driven by the participants of those groups. We want people's experience to be based on what they would find helpful. We also do a lot of work with our community partners, so kind of commissioning and collaborating with community organisations when there's funding. So the kind of setup of the Community Justice Partnership, there isn't any budget that sits with our partnership. So a lot of what we do is around trying to work with partners or influence partners to kind of support pieces of work, and sometimes do things like justice social work, who've recently been able to fund a number of kind of projects that the partnership have taken forward, which is really positive. And then finally, the collective voice report. So this is something that Moray Wellbeing Hub kind of take the lead on, and this comes to our partnership every quarter when we meet. This kind of is a standing item on our agenda, and it really, I guess, provides that kind of faster access into people's feedback and insights around things that are happening in the community in ways that I think we don't capture in those more formal settings, I guess. And when we're, I suppose, asking formal questions about things, we're often asking it about certain parts of the system, whereas actually this allows feedback about the whole system and every experience and every service that people are accessing through that. So I think there's a real value in that collective voice that I suppose is quite unique compared to other forms of sort of data gathering through lived experience that we're able to do. So myself and Justin are involved in the steering group for that, and there has been the kind of recent development of the digital tool for collective voice, and we're really excited, I think, to see where that takes us and how that allows us to connect into more voices within the community. So we also, I think, as a partnership have learned things through that we haven't learned in those formal settings. So there had been examples of things that had been fed back, for example, through some sessions in the prison that we've never ever heard through our formal feedback gathering. So and we were able to then act on that. And I think that's really important to note, that it gives you the opportunity to hear information and be like, actually, does that fit with what we're hearing? Are we aware of that? Let's go and dig into that a bit more. And sometimes we're not able to identify an action necessarily from a piece of feedback that's come through in that report, but other times we are. And again, we kind of track over time as well. If we're seeing the same types of comment coming up time and time again, that becomes a bit of a theme, a pattern that we then look into. So yeah, it's been a really helpful thing for us as a partnership. So turning insight into action. We kind of, lived experience is considered alongside that quantitative data and other evidence, as I mentioned, and it helps us to identify strengths, gaps, and priorities in Moray, which ultimately informs service improvement and partnership activity. And we hope that kind of that's supporting that influencing of change across the wider justice system. It can feel at times that the justice system is this big unmovable beast, but actually there are lots of parts within that system that we can change and improve for people. And we really value and need to hear people's experiences in order to understand how they, I guess, all those things interact with each other. So yeah, I guess we're not trying to just ask people to tell us what their views are, though. We really are working hard to create opportunities for people to influence planning, program development, and system improvement. So I will now pass you over to Justin, who's going to talk about the ADP.
So how the ADP uses lived experiences system intelligence is through gathering intelligence through multiple feedback loops. We currently have 5 feedback loops, which would be collective voice, lived experience, panel, experiential interviews, charter of rights engagement, our residential rehab feedback, and then obviously through our events and our rights-based events like Recovery Together events. One of the ways we collect informal feedback is through our recovery communities and peer networks, through our family and carers feedback, community conversations, service feedback and engagement, and through the staff, the frontline practitioner insights. Through our experiential interviews, we interview family members who are affected by substance use. We interview staff who are working in substance use services, and we interview people on their experience of our services. We then take that and take it through a thematic analysis, and through that thematic analysis, we develop an outcome improvement plan. So we take voice, we turn it into themes, we then analyze that, we use our intelligence towards us, and what I'm explaining is the FAIR model, and then that constitutes change within that outcome improvement plan. Can move to the next slide, please, Ainya. So from lived experience to rights-based improvements. So our approach is to gather living experience, to identify what are the common themes and the priorities that we're seeing on people experiencing services, to analyze that through rights-based frameworks, which would be the FAIR model and the AAAQ model, co-produce solutions with our lived and living experience panel, and then review any impact and learning. We also like to do our feedback loops, and every year we do events where we offer feedback through our experiential interviews and that thematic analysis on our priorities for the next year, and as well as do a developmental session with our lived and living experience panel on those priorities. So I think for us, we wanted to move beyond simply collecting feedback. We wanted to combine rights-based frameworks like the FAIR process, the panel principles, and the AAAQ framework to create a structured approach for analyzing lived and living experience, and then use that for service improvement. This helps us not only understand what people are telling us, but what it means for people's rights and what actions are required to improve services and outcomes to meet those rights. So I've put together a bit of a case study today, and I'll just give you a brief breakdown before I show you the framework that it's built on. But one of the case studies was about welcoming and trauma-informed environments. People had said to us through multiple feedback loops that they didn't feel our buildings were safe, they didn't feel that they were trauma-informed, and they didn't feel that they were welcoming. So some environments felt stigmatizing to people, their privacy and confidentiality felt concerning. Disabled access and accessibility was very limited. We had a group room upstairs that wasn't accessible for everyone. spaces were definitely not trauma informed, and the clinical environments did not always meet people's needs, and they also didn't meet the services needs. So we took it through a rights-based analysis, which is what the AAAQ is. So the AAAQ is based on availability, accessibility, acceptability, and is it quality? And that is a rights-based framework. So are appropriate environments available? Can everyone access those environments equally? Do these environments meet people's needs? And are these environments safe, fit for purpose, and trauma-informed? So what we developed in Moray was a Moray Charter of Rights toolkit, and what you see before you is the Charter of Rights toolkit. So what we did was take each right and then take different feedback and sort that out into which right it pertained to. So this is right number 5, and it's a right to a healthy environment. This right recognizes that a healthy environment is necessary for the enjoyment of all human rights, including the right to the highest attainable standard of physical and mental health. And so if you look at the as-is analysis, that green block on the left, that would be lived experience voice. So the right that was identified was that people felt that there weren't safe spaces, they weren't welcoming, private, or trauma-informed. So what was available, we looked at what our services had available. We've got 2 services in Moray. One is obviously our MADP, our specialist service, and the second service is Arrows, which is our direct access front door service. So Arrows building was in the high street. It was opposite the courtroom. It didn't feel really confidential. The group room was upstairs. And MADP building, which was a shared building with community justice, people didn't feel comfortable that the building was shared with community justice or is shared with community justice, but that's what we had available. Was it accessible? So as I mentioned, Arrows was accessible in the high street, but it wasn't accessible because it didn't have accessibility for people with disabilities. Families could not come into the service. So if a mom needed to do an appointment and she had a young person with her, the young person wasn't able to be within that service. So it wasn't a trauma-informed environment. It was limited access for disabilities. And then our other service, as I mentioned, was co-located with justice services. It caused stigma for people. It wasn't a suitable environment for us to deliver clinical procedures. And it also hampered us on our MAT4 because we didn't have the clinical space that we had to do our clean works or IEP, bloodborne virus testing and all of that outside of the service. So was this acceptable? And what was the acceptability of these buildings? So the rooms within Narrows building had upper floor rooms, which were not accessible. So that's not acceptable to people. In addition, the Arrows building is not in a private location. It was opposite the courts and next to a local pub. And this is what the voice of lived experience was telling us. The waiting area was very small. The ratio is used to prevent conversations being heard. Sorry, the radio was being used to prevent conversations being heard because there was limited office space and paper-thin walls. And it wasn't soundproofed and it wasn't suitable for visitors and children. And was it quality? Both buildings do not meet what we were looking at for MAT standard 6 and 10, which was trauma-informed environments at that point of MAT. And also for MAT4, as I mentioned, we weren't able to deliver clinical from the MADP building. So we had to implement duty bags and do everything on assertive outreach to be able to meet that standard. So what was the Charter of Rights action that came around from us using that AAAQ framework? So the work that we did was we raised this with NHS Grampian as high risk. We recorded it on the risk register with regards to the clinical risks that were not being met. We spoke with the management asset group within the Health and Social Care Partnership to start exploring alternative accommodation for our NHS service and through Moray Council. The Moray ADP explored suitable venues for the Arrows and MADP team. We worked very closely with Arrows and supported them financially to be able to look at buildings that would possibly look at almost a co-location of the teams. And luckily for us, and through all this work, Arrows were able to source a suitable location. The ADP supported the ability for a clinical practice room to be put into that location. That clinical practice room would also include our psychology, a new psychologist, which was MAT Standard 6, about psychologically informed services. And we were able to work with lived experience to co-create and co-design what that building looked like, to support the walkthrough, do a trauma-informed walkthrough. And in the longer term, we will still be looking at requiring a new location for MIDAS to be able to have that separation of specialist as well as third sector services. So you get all of that, you get to the action, and from the action, you'll go to the UN principles, and that is the next page, Ainya. So when you look at the UN panel principles, we would have seen, okay, there was an action that came from that Charter of Rights, and it was that Arrows had sourced a suitable location. The ADP had supported for the ability for clinical practice to include psychology and trauma-informed space within that building for the MIDAS service. And in longer term, we would still be looking at requiring a new location. So who participated? So experiential interviews took place. Because of those experiential interviews, we got this feedback that people didn't feel that the building was suitable, or that both buildings were suitable for their needs. And that was also mentioned within our staff feedback. Trauma-informed officers from Moray Council helped us with the walkthroughs, as well as a trauma-informed officer from Quarriers did the walkthroughs with lived experience to be able to design that building, and that's how people were participated. Who's accountable and who was accountable for all of this? Obviously, the Alcohol and Drug Partnership is accountable. Quarriers are accountable for the building, the upkeep of the building, and the support of people, and the Health and Social Care Partnership in helping us to locate accountability on what we would be doing with the MIDAS building. So how did we take non-discrimination and equality into account? So the new location we looked at is semi-residential, there's car parking, and there's disabled access. So we moved it away from the high street. It's trauma-informed officers and LLE co-designed the new location. And the clinical space for the MIDAS team provides better access for those requiring the service. So how were people empowered, and what capacity building took place? So the voices of LLE was taken forward and central to the realization of this location, and LLE were involved with the co-design of the new location. They were also involved in the tendering process for actual Arrows service and sat on the scoring panel and were part of the design of the specification for that service. And legality, how was that taken into account? So we raised awareness with the general public on the new location of the service. We promoted the new location of the service to raise awareness for people using that service. And then what you would get through all of that, running through the AAAQ and the UN panel principles, is the output and impact that you would be looking at as a result of this. So what would be the outputs? A fit-for-purpose trauma-informed environment, so people could feel more welcome, have services that they relate to, that they feel comfortable in, the same as any other service for any other person. So what was the impact? We could increase the footfall of people accessing the service. We would also meet the needs for people of disabilities. We now had downstairs group rooms. We had closer collaboration across the teams in terms of the specialist service as well as the third sector direct access service, Arrows, because they were now sharing a clinical space. The psychologist was now down at the third sector and not just accessible through a specialist building or an NHS building. So it brought together closer collaboration and improved communications across the services in terms of risk and people at risk and how the services work together. The evidence of this impact is hopefully going to be provided and has been provided through our this year's experiential interviews, where we ask questions on how are people feeling about the service, accessing the service, the buildings of the service, and also what it helped us in terms of is it had an impact on our MAT standards, on MAT standards 6, 10, and 4, where we were able to meet the criteria, particularly around MAT 10, where we met the criteria of trauma-informed environments. And that's how we've taken a Moray Charter of Rights toolkit, a rights-based framework, lived experience, and used it as system intelligence to provide improvements across the work that we do as an alcohol and drug partnership. On to the next slide. So in Moray ADP, lived experience helps shape strategic delivery planning. Our strategic plan was built with consultation of lived experience, not only locally, but also nationally. We tapped into organizations like the Scottish Recovery Consortium and Scottish families affected by substance use or affected by drugs. Our MAT standards implementation is based on 3 forms of evidence. You have your clinical or process evidence, which would be your SOPs, your pathways. Then you have your numerical evidence, how many people are accessing the service, how many people are receiving MAT, what is the turnover, are they receiving that in a day? And then most importantly, to round off and be able to get a green rag rating on a MAT standard is your experiential evidence. And so that would be our experiential interviews, a thematic analysis of those interviews, and seeing that onto an improvement plan. So 3 forms of evidence, but the lived experience evidence really shapes the other 2 because it tells us how people are experiencing that and experiencing those services. Through our Charter of Rights implementation, we are using it. As you can see, I've mentioned and shown you an example of the toolkit and how that helps meet a right and make sure that people are receiving the same rights as anyone accessing any health service. Through our residential rehab pathways, we've worked with lived experience on that pathway. We continue to work with lived experience on the barriers that people might experience through that pathway, and are really on a learning experience on how we refer people to residential rehab, how we support them with that. Some people might have animals, and how we are able to support them with care for the animals while they're down in treatment, or even treatment centers that accept animals. All of that's come around through lived experiences voice around the experience of residential rehab. Obviously, through our recovery development, similar to what Ainya said, we have a lived experience development worker who specifically works with lived experience. And obviously, we've developed a lived experience panel. We have a living experience group, which is people at the highest risk who are currently still using substances, who are able to express the barriers that they're currently facing, the difficulties in accessing service. And we have a management group around that, which Ainya is also a part of, where we're able to look at that and look at what supports and also feedback to them what we've done to improve as a result of what they've told us. We've looked at workforce development. All our teams have been REACH advocacy trained, which is advocacy training based on the Charter of Rights, rights-based recovery, and the UNRC. I might have got that wrong. And then obviously, through service improvements, as I've mentioned, we take this onto an improvement plan. We have 2 types of improvement plans. We have a MAT improvement plan and an ADP improvement plan. And within our new strategic delivery plan, we have a quarterly update using that Moray Charter of Rights toolkit on the improvement that we've done on services through lived experience feedback. Obviously, we've worked with commissioning, and our commissioning priorities are to co-create and co-design services with lived experience at the heart of that co-creating and co-designing of those services. And they've helped us with the service specifications, the voting on contract extensions, as well as being a part of those tendering and scoring panels and contracts. And then through our partnership planning and decision making, we're hopefully looking at bringing a lived experience development officer into our ADP team who will work directly with lived experience and our services, breaking that gap between people using services and be able to bring everyone together through the rights-based framework and looking at the improvement that we could do through that. And then lived experience for us, it's not simply feedback, it's a source of intelligence that helps us understand whether our systems are working as intended, where barriers exist, and where change is needed. By embedding lived and living experience through our planning, commissioning, procurement, service delivery, and evaluation, we can build services and systems that are more responsive, that are effective, and grounded in the realities of the people that they are intended to support.
Okay, thank you, Justin. So yeah, we know that system intelligence that's rooted in lived and living experience and data is a work in progress, but feel that every step towards that meaningful participation is helping us to build services and systems that better reflect people's realities. So for us, when we're considering that, I suppose it's helpful to think about what would good look like. So people are heard, their experiences are captured consistently, and their insights influence decisions and ultimately change. So thank you so much for listening along today. You've hopefully made it this far. I've popped both of our email addresses there, as well as the kind of generic email address for Community Justice and for the Alcohol and Drug Partnership. Please do reach out if you have questions or want to know more. Also look at the website and see if there's information on there. And I think if anyone would like to hear more and has more questions and things, would like us to come and chat about that or provide an input to a team or to a group, then we'd both be really open to doing that. So please do reach out. Thank you.
Yeah. Thank you, everyone.